Facebook. He saw all the behind the scenes stuff. So we're going back live here. All right. Boss lady, we will save this the video so you can go back and watch it. So I know you said you came in later, so you will be able to go back and watch it. See, guys, we're getting a wealth of information here, so I'm hoping you guys are enjoying this session too. Oh, there's Dr. Patrick. I have a little tickle in my throat here. Okay. We're live. We're back. Yay. Anthony, I see you on Facebook. Thanks for joining us. All right, give everybody a couple more seconds here to come in. I did see another question on Facebook that says, how big a problem is coccidiosis in small ruminants?
Big problem. We've seen it quite a bit. We're seeing cases of kids. Their intestine was lined off with these little white nodules filled with the parasite. So it's a very big problem. We just need to know how to treat it properly. There are different type of drugs out there that we use. Farmers might be trying different medications. Not antibiotics won't kill coccidia. There are specific medications that are available, and that's what we need to administer. We don't like to talk about certain drugs online. We always say if a farmer has a problem, we make the recommendation, prescriptions, and then we take it from there.
Okay. I was just going to ask you what are the recommendations, but I was just going to ask what the recommendations are, but you rather yes, and make
Yeah,
it.
it's for ethical reasons. It's best, we generally don't do treatment over over the phone. If we're talking to an individual farmer, but that's how we were trained, and that's how we like to keep it. So we always let farmers know what they need to do, because then farmers start to try different things, and then they generally do more harm than good sometimes. We notice.
That's like taking somebody else's medicine, right? Somebody else went to the doctor, you take.
Yes, exactly.
So, did I miss any? Guys, whatever questions you had before, go ahead and send those back again to me because I lost them when we ended the live. I'm trying to see if I missed anything over here. Here. As you have an expert here, go ahead and send your questions. Any? Dr. Patrick, you did such a phenomenal job. There are no more questions. Hold on here. Okay, so one thing I forgot to ask you. You have a lot of letters behind your name. So ASC, DVM, well, we know what the PhD is. So what's the ASC?
So the ASC is associate degree. That's the one I got from CASE. Then I got the DVM, Doctor of Veterinary Medicine and Surgery. PhD was in pathology. That was then the diploma is it's a translator. It's for Russian English language.
All right, very cool. So guys, if you did not pay attention in your high school biology class, you need to follow Dr. Patrick because he has lots of great pictures for you. They're great pictures if you didn't pay
Yeah.
attention.
And those are just pictures from, I travel around and I see a case. I'm a pathologist. I do postmortems. I collect pictures and show people what's happening out there. The last one posted was heat stress. We spoke about that recently. And you see what heat stress can do to a labor. They're still laying in active lay, but then, the pathology is phenomenal. So I try to educate people on, what's happening around there. And there's also a picture of the broomweed problem with the brain. That was the actual brain from a goat from that particular farm who was having the problem. So, with a detailed description of what happened.
I saw the heat stress of the chicken. I didn't see the broomweed of the goat. I got to go back and look for that one.
Yeah, so there's just one brain, a picture of a brain, and that was that broomweed case of that particular goat who we did the postmortem.
Very good. All right. So I have a question here that says, Why does my month-old grind?
Say again?
Why does my month-old kid grind its teeth?
Okay, so when an animal is grinding the teeth, it doesn't point to any one specific condition. Animals will grind the teeth when pigs do it when they're hungry. When an animal is sick, then they grind the teeth. So, we need to figure out what condition they're having. They could have a worm burden, they grind the teeth. So there are quite a number of reasons why they do it. So then we need to figure out what's happening right there. So we can't say if they're grinding teeth, this is a particular problem. It could be a host of different things. So we need to investigate that.
Right. Hi, Dr. Young. I see. Okay, let's see. Will you guys bring in the Savannah goat semen?
I cannot say yes or no. When we do something, it's based on popular demand. If farmers are asking for it, then we do it because we don't like to impose anything on farmers. If we carry a particular semen, it's because farmers are saying we want this one. So if Jamaica says they want Savannah, then we will bring Savannah.
All right, very good. Are you looking into the process of embryo transfer in goats?
Embryo transfer in goats, that is something that we also do and something that we can do. We do that, there's a different method of assisted reproductive technology, the laparoscopic AI that we also do. I'm pretty sure you'd have seen a video posted recently of Dr. Young carrying out such a procedure. So yes, we've tried that before and we've done that before, and it's something that we can do easily. Just that it's a different it's a different protocol. We have to treat the animals differently. It's a longer protocol. But yes, we have the know-how and it's something that we have done and we can do it.
Okay. All right. Let's see. I think this is, yep. I've gotten all the questions. Then
Somebody's asking about the cost of the laparoscopic AI and embryo transfer. I do not have a cost in my head, but I can tell you that you'd still pay for the price to synchronize your animals, which would be similar along the line of what I mentioned earlier. The embryo cost, I do not have the cost of the embryo. You'd have to pay for, but in this case, you'd still need to pay for a veterinary fee because this is something where we have to anesthetize your animals, so they have to sleep, and it's a surgical procedure that we do where we have to actually enter the abdomen of the animal and put the embryos in a, not in the uterus as a semen, but in a different point, way up in the tube actually. So it's much more invasive. So it will be a little bit more costly. And if farmers are doing this, then we always can, send a pro forma and show them the entire printout of what everything will cost.
okay. Dr. Yun says embryo cost alone is 500, 600 US dollars. And do you currently have any embryos?
We there are what there's one farmer who brought in embryos, but for ourselves, no, we don't have embryos. But if farmers are asking for it, it's quite easily to get them in. But at the moment, we don't have any in stock that we can actually just go out there and do. No, just semen. But
All
we do
right.
have embryos for cows if they want that for dairy cows.
So somebody's asking again, we're going back to coccidiosis. What are the symptoms? So just that if I call the vet and I need to know, so I can have an educated conversation with the vet, right? So can you give us some ideas of give us some of the symptoms of if my goat has coccidiosis so I can speak intelligently when you call me?
Yes, so coccidiosis basically it damages the intestine of the animal, and there are some animals where it even damages the liver, and you can get very dark feces because if the intestinal tract is bleeding, then by the time it gets down to the anus, it becomes very dark. So you might see blood in the feces. It's probably one of the main signs that you'd see with coccidiosis. In chickens, you'd probably see frank blood. In your goats, they tend to waste away. You can have diarrhea, and if you check under the microscope, you see those little oocysts we call them, which is diagnostic. So, but as a farmer, you probably only sign you're going to see is probably blood in the feces.
Okay, so physically nothing other than bloody feces. main thing that
Yeah,
we're.
and then the animal is not doing well, but it's not, the signs that you see in the animal is not actually, it's not pointing to any specific disease. It could be anything. You really need to go and do a workup to actually find out what's going on.
Okay.
But you probably will see blood in the feces.
Okay. All right. So let's see. I can Facebook see. Have I gotten all the questions on Facebook? I think so. I don't want to leave out my Facebook crew, you know. So, all right. Can't think of guys. Your opportunity is going running away fast. So, there's a Facebook question. Okay, hold on. Hold on. I'm trying to find it. Why does the tip? Why does the hair at the tip of a goat's tail flare into a V shape instead of being pointed?
Why does
Why
the
does the
hair?
tip of a goat's tail flare into a V shape instead of being pointed?
I don't know if that's a scientific question. I don't know if I know the answer to that question, and I don't know if I understand it very well either.
I'm not sure if I understand it either. Maybe just the shape of it. Maybe that's just the way God intended. I don't know.
I'm not sure.
I'm not sure what the answer to that is. Okay. Even Dr. Young is like, what? That's
Yeah,
not,
there's one other condition that we saw happening with goats. We saw that on a farm recently. The farmer was treating it as something else. They didn't know what it was. They thought it was a dermatitis. Well, it was a dermatitis. They thought it was a parasite, or you see it happening on the tip of the hair. You see it happening, especially on the face. If you have white goats, um, you know, there are quite a number of white goats anywhere on the skin that is white. And then, if those animals are in the sun, then you start seeing all these little dermatitis sore all over the skin. Um, you know, they didn't know what it was, but when I saw it, it was quite obvious that once you get these animals out in the sun, goats, it happened to quite a number of animals. There are certain plants out there, um, they have certain pigments inside them, and once animals tend to eat those plants, um, and then they're exposed to the sun for quite some time, you start having these dermatitis problems. And they were treating it with aeromycin spray and antibiotics, and it wasn't really going away. So there's something called, let me see if I can remember the correct name of it. It's called photosensitivity reaction, where these plants, they have a particular pigment inside them. I don't know if well, for farmers the name might not be very, you know, important, but there's something called phytoerythrin in the plant. It's a breakdown of the chlorophyll. So we do know that chlorophyll is a green pigment in plant. It interacts with sunlight to make food for the plant. And once this chlorophyll is broken down in the animal, it forms something called phytoerythrin. It circulates in the blood, and that phytoerythrin, it attracts sunlight. And once it attracts sunlight, just like the chlorophyll, then the animal's skin get burned up, and you'll see that happening quite a bit in your white animals. Once you see that there are certain animals out there, certain plants out there that contain that particular pigment, and it can affect your animals. Once you see that, it's advisable that you treat it, you know, just a normal antibacterial spray, maybe some gentian violet, and keep the animal out of the sun. Some antibiotics for secondary infections. It's not something that generally kills the animal, but it can be a problem in your white animals. We see that happening quite a bit.
okay. All right. Leon Golding is in Kingston, and he would like for you guys to come and visit him. So I need to give Leon some contact information.
Yeah, what Leon could do is basically just, all our information is online at Nutrimix website. Once you type Nutrimix in, you can find that, you call, and then you get in contact with one of us, and we will come and visit you.
All right, very good. Very good. All right. I don't see any more questions. Am I missing anything? Oh, somebody said the tail thing, they call it fishtail. I don't know. That original tail question. So, all right. I don't see any other questions, Dr. Patrick. So I think you did a phenomenal job. Thank you very much.
I
Guys,
hope so.
for joining us. So we will be back next week. And of course, we'll let you know who the guest is when we have it set up for next week. So thank you for your time, Dr. Patrick. And
Thank
everybody,
you.
no, no, baby's gone to bed. All right. So thank you guys. Have a great evening, and we will see you guys next week. We love you guys. You're faithful, and we love it. Thank you so much. See you guys.
Thank
Thank
you very much.
you. Okay. All right. Bye bye.